Business is the force of change. I would like to quote Anita Roddick in Business as Usual to strengthen my point here. She writes, in terms of power and influence, you can forget about the church, forget politics. There is no more powerful institution in society than business. A small but significant question that this conference seeks to bring forward is, can CSR help build the dilapidated healthcare infrastructure in the country? What can be the strategy to fix that? Who will play the chief strategist? If I am to answer these questions, I would rather choose to say it in one line. It's not a one-man's job. A new economy has emerged at the borderlands where traditional sectors overlap. This economy trades in social outcomes. Its currencies include public data, reputation, and social impact. This is the solution economy. And it is not run by one man, by one decision maker. It is built through collaborations, partnerships between traditional sectors which were once disjoint. Today, they have a common grey areas. This all might inspire a touch of skepticism, but the waveforms are changing their course. And this very basic illustration forms the core of today's panel discussion. This panel discussion aims at looking beyond the traditional healthcare activities-based interventions to larger partnerships and programmatic approach. We have with us as our panel moderator, Dr. K.K. Upadhyay, Head CSR FICCI, Aditya Birla CSR Center for Excellence. Dr. Upadhyay has over 3 decades of experience in government, voluntary and private sector. A corporate social responsibility and sustainability expert, trained by CBI Netherlands and an environmental management systems auditor. He's on board of several expert groups and high-level committees of the government, UN agencies and autonomous bodies. I leave the floor to you, sir.
So nice, thanks. You saw in the morning, when we talk about health, the biggest player is the government. Because as a social welfare state, we are supposed to provide those services. And now we have gone into the mission mode, whether you talk water or anything. And we have this whole mission about the health mission now, where we have the National Rural Health Mission and the National Urban Health Mission. The idea is to provide service to those who don't have them. As you saw in the Praveen Bhai's presentation also, the speak, he talks about the technology, he talks about the reach, and he talked about the implementation part of it. When you come to the private sector, you say the health sector as such, it's also itself a big sector, where 80% is the private players here. And the division is very big, like say, when we used to talk about the urban health mission, there was always talk that cities have the big hospitals, the Apollos and all. So where's the problem? When we tried to research that, we found that the poor, he doesn't have first thing, the courage to go there. That still happens there, like say, if the facilities are also made available, he will not like to go there. And another thing is also, these people also, though they do very good CSR, most of them, their reach also is not so much, like they can reach to at least a sizable population of these people. When we had this industrial area in Gujarat, where Reliance, CSR, all the big players were there. Then in industries, generally, what we work is, the first thing is education, of course, and health. When it came to, like, say, for their workers, because problem there is, like, say, you can't have a government hospital there. Why you can't have a government hospital? Because the